Both governments and business have long turned a blind eye to pollution of Indigenous communities. For example, for over 60 years, and we have an illustration over here, Grassy Narrows and Aamjiwnaang First Nation communities northwest of Dryden have suffered the devastating effects of mercury poisoning. In the most recent study, over 58% of Grassy Narrows and Aamjiwnaang residents examined were diagnosed with or suspected of having Minamata disease. Minamata disease is a serious neurological syndrome caused by mercury poisoning. Mercury poisoning damages cognitive abilities and can cause tunnel vision, deafness, numbness, shaking, difficulty walking, even death. Numerous other First Nation reserved communities lack safe drinking water. At the ECO's last count, 36 First Nation communities in Ontario are affected by a drinking water advisory that has been in effect for more than a year. And of those, 17 communities have been affected for more than 10 years. The federal government has the primary responsibility for water infrastructure and regulation for First Nations reserved communities, but the Government of Ontario can and should help by protecting their water sources and by providing more technical expertise and training. The Aamjiwnaang First Nation, located in Sarnia and surrounded by heavy industry, suffers some of the worst air pollution in the country. Altogether, the industrial facilities of Chemical Valley release millions of kilograms of pollution into the Aamjiwnaang and Sarnia airshed every year. There is strong evidence that this pollution is causing profound health problems. Aamjiwnaang is well known for a 2005 study that confirmed a skewed sex ratio of babies. 2 girls are born for every boy. Other studies have found higher than average hospital admissions for respiratory and cardiovascular illnesses, higher than average incidence of some cancers. In Aamjiwnaang, a shelter-in-place siren may go off at any time because of dangerous pollution when the air is not safe to breathe. Residents must immediately go or stay inside, seal their air intakes, and await further instructions. And even these warnings have proved unreliable. Such conditions would not be tolerated elsewhere in Ontario, yet they have long been deemed unworthy of priority, effort, or expense.